right, welcome back. I'm your host, Michael Stamatinos with the Advancing Healthcare Innovation Show. And if you're new to us, man, we're super excited to have you here because we're bringing you real and exciting conversations with leaders who are painstakingly shaping the future of healthcare. And we're really passionate around innovation, adoption, leadership, access to care. And if it's your first time tuning in, let me just sort of share a little bit more about what we're doing here. So we're a healthcare innovation company, and we're focusing in on bringing real stories of innovation within healthcare to life. And the aim is to talk to real people that are truly innovating within our space, peel back the layers of their story, and give them a platform to share their story with the world. And we've got just an amazing year that's packed with new content, incredible interviews that have been planned. And if you haven't checked out any of the historical interviews, hit the subscribe button now so that you can get any of the new interviews right into your inbox. So with us today, we're just really excited to have Julie Sachs. She's an executive extraordinaire, a clinical social worker at her core, and just a healthcare trailblazer transforming access to healthcare. And she's currently the president and chief operating officer at Home Centered Care Institute. And over the last 2 decades, Julie's dedicated her career towards improving access to healthcare, leveraging her skills as a social worker and an executive in a variety of roles. And she's not just been instrumental in steering the organization, but also making primary care at home a norm. So it's because of her continuous efforts to bringing home-based primary care into the healthcare mainstream that I think it's placed it more on the map. And I don't think there's ever been a more important time to have this type of conversation. So Julie, it's amazing to have you onto the show. Welcome.
Thank you so much. Glad to be here.
Yeah, so tell us, maybe if we just sort of pull the tape back a little bit. So you're a clinician by trade. Talk a little bit about sort of your evolution going into care at home and maybe fast forward to today and what the organization looks like.
Well, it's interesting. I think that's true. I'm a clinician at core, but I started in my career in advertising and marketing. My background in advertising, and I worked in my first job was advertising. I've done a lot of marketing, and it's interesting because in a lot of ways, I feel like my role now has sort of become full circle because, I mean, just even being here today, what do you do when you kind of come up with a great idea? You have to tell people about it, right? And so it's been a really fun process. But yeah, I first did home visits as a social worker. I was working with foster care in the foster care system and would do home visits there, and hadn't really thought about medical home visits until coming to HCCI. And I came to HCCI after a pretty good stint with the American Parkinson Disease Association, where I worked directly with patients some, but really just grew a program that was focused on young people with Parkinson's disease and how they manage the disease on a daily basis. And so I've done a number of different things, and there's a way that I feel like kind of what I said, that what I'm doing now brings elements of basically everything I've done in the past. It's just sort of come into a situation where I can integrate all of those different perspectives to do what I do today.
I've said this on other shows, and it's about your previous tours of duty and how you aggregate those experiences for preparing you for the mission that you're on now. So tell us about the mission of Home Centered Care Institute. What is sort of the reason for its existence, and how has that shifted today, just kind of given where things are?
Well, you said it was my vision. I have to give credit where credit is due. It was really originally Tom Cornwell's vision. Dr. Tom Cornwell, a house call physician, he's done over 35,000 house calls in his career. And for many years, he had a practice in the western suburbs of Chicago. It's now that practice he's no longer with, but it's part of the Northwestern medicine system now. And he was doing this even when it didn't make financial sense to do it. He is kind of a missionary at heart, did this because it's the best way to take care of very, very sick patients. And and had this vision that we needed more of this across the country, that we needed more people trained in it to be able to take care of the need. And we knew that we saw the need coming down the pike, right? That more people are aging. And we know that people want to age at home, that's where people want to be, not in a hospital, not in an ICU at the end of their days with their family at home. And so he really had this vision and got some supporters behind him to help start the Home Centered Care Institute, which started around 2014, 2015. And I joined the organization soon after, at the end of 2015. So I've really been able to witness this journey from the beginning. And so our first sort of foray into, I guess, innovation was we created the nation's first home-based primary care curriculum for healthcare professionals. And so we started with 1 2-day course, and that has turned into multiple courses and online courseware and a practicum where professionals can go and shadow others who do this work. One of the other kind of innovative things about us is that
Wait, so you're saying up until that point, there wasn't a standard of care?
there was not, there was, I guess what we would say is everybody was sort of recreating the wheel. There were a number of academic house call practices across the country that had done this for a number of years. There was one at the University of Pennsylvania, one at, there was Tom's practice, there was one at Mount Sinai has been doing this for many years. So there were a number of academic programs, and what HCCI did was we brought all of those experts who'd been doing this for years together and created, sort of culled their knowledge and said, we know every house call practice or program is different, but what are the things that every program must do and do well? And one of the unique things about that is that we didn't just look at clinical, we looked at practice operations in the back end as well, because you have to be able to do this well and efficiently if you're going to be sustainable. And especially under fee for service, which is how so many of these practices started, you had to be very, very particular about how you operated your program. So we brought those experts together and we created sort of the first, what we call the nation's first home-based primary care curriculum.
You know, there's something to be said about innovation and collaboration. It doesn't have to be something that's just so going to Mars. This is something that, hey, someone is doing something, and you ought to be able to have a platform to be able to share these best practices in a very easy way. And sometimes that's a little easier said than done.
And when I started, you know, Tom Cornwell was very intentional. The first few years, the first thing you would hear us say when we described HCCI was, we are a collaborative nonprofit. That was the number one word that we used, because we knew that there was no reason to do this by ourselves. We wanted to be the facilitator that brought everything together.
And what's happened since then from a collaboration standpoint? Any really cool stories that you can share with the community as far as what has that led to from an outcomes perspective?
You know, one of them are really neat partnerships, I think, is with CTAC. Do you know CTAC? The Center to Transform Advanced Care. So that is an organization, it's a membership organization focused on bringing together industry leaders who are focused on exactly what it says, transforming serious illness care. So they want to make sure that that everybody has advanced directives in place, that everybody's able to explain their plans and have those plans known by their families. And they primarily work in the hospice and palliative care space. HCCI was one of the first, I think, and maybe biggest home-based primary care players. And we sort of partnered with them, and we brought a lot of awareness of the need to integrate home-based primary and home-based palliative and hospice care. And I would say that's one of the things that we've been really kind of outspoken about, is the need to integrate the different types of home-based care. You know, I always tell people, I think it was either brilliant or a wonderful accident that we named ourselves the Home-Centered Care Institute instead of the Home-Based Primary Care Institute, because we have seen over the years and continue to see things evolving more towards the integration of that continuum of care. And I know we're going to talk about this new platform we have, but it addresses all of the different aspects of home-based or home-centered care.
And up until that point, what were some of the blockers that prevented palliative, hospice, home-based primary care from kind of all being somehow interconnected? I think in theory they all understood that, but what were some of the main blockers? What were the things that were getting in the way?
I think the biggest thing is that we all know that health systems work in silos. And to some extent, it's still a challenge. I mean, we address that every day. But I think we all intuitively know that that needs to happen, and that that's the best kind of care that one could receive. But until recently, the payment models weren't such that that was incentivized. If you're being reimbursed based on fee-for-service type of situation, you're providing a service and you're getting reimbursed. There's not an incentive really to make sure that that care is coordinated. Now that care coordination is a thing in and of itself, it does make sense. And so so that's another area that HCCI plays in. We have partners where we work more than individually, but with payment reform and advocacy, we do help on that front as well to try to keep those payment changes happening.
Well, when you talk about when Dr. Cornwell started, you said he was doing these visits because it was the right thing to do. However,
Yes.
financially, it just didn't make sense. At what point did it make sense, and what were the things that occurred in order for it to make sense? Or are you talking about changes that happened within the last 36 months? Or are you talking about changes that happened, years prior? Give us a little bit of a timeline as to when we started to see this kind of uptick a bit more from a home care primary based care, at home standpoint.
I would say it's both. So 8 years ago, they started Independence at Home, the demonstration project. And that was really a big win for home-based primary care. And it was, they say it's Medicare's most successful demonstration project ever. It's saved over $100 million. And that really showed that this can be successful, that it can save money across the system. And, it was really never expected for the practices to save as much as they did. And so it really was a huge win. And then I think that has led to further payment model changes. And so we see now that CMS has done its sort of refresh, this 10-year refresh, that they're trying more and more different payment models. And many of them are more friendly to home-based care than they used to be. And then, of course, when you say the last 36 months, the pandemic was really a game changer for this type of care, in that it not only changed some things as far as like telemedicine and things providers could do, but I think it also made the general public more aware of the need for this, the value of it, and how much people would prefer to have this kind of care available to them at home if they could.
I'm curious about the demographics of clinicians that are in home-based primary care. Are you looking at clinicians that are at, mid-career, towards the end of career, or emerging within their career? Where have you seen? I'm just curious, and what is their what is their threshold to innovate?
We see, I would say we see it across the board, but we know that nurse practitioners are the fastest growing professional audience that is doing this kind of care. I
Yeah.
think there's a way that nurse practitioners um, have sort of in their training a more holistic view of the patient and patient care, and it just there's a way that resonates with that profession. And then there's an organization we've worked with some called NNPEN, which is a nurse practitioner entrepreneur network. And
Cool.
that's a really interesting organization. And it's exactly to your point. It is nurse practitioners who want to be entrepreneurs, who want to, maybe they want to hang a shingle or not hang a shingle on their car. They want to, jump in their car and start going to see patients, but oftentimes they want to then grow that practice. And, and that's what HCCI does. We help practitioners and practices grow.
That's amazing to see those level of collaboration. Shout out to Rebecca Love, who we had on the show here, that really kind of talks a lot about nurse innovation and also how nurses are they're very entrepreneurial. So it's interesting to see the effect of nurse practitioners coming in, wanting to then sort of establish a practice and then to continue to grow that practice. And I guess it's interesting to see that is the fastest growing area. And I was just, the reason why I asked that question prior is because I said, well, is it more of an age thing, in the sense that someone that is, maybe mid-30s, early 40s, they're not necessarily tech savvy, rather maybe they're tech dependent. They grew up with smartphones. They view innovation as, hey, this is something I can embrace. This is something that I can really leverage to help scale. So I was just curious if there were any parallels amongst that. So you did answer that very nicely. I appreciate that.
Well, I think also, not all of us are old enough to remember, the Marcus Welby black bag doctor, but we often refer to what we do as the modern day house call. And to your point, there is so much technology. And if you think about it, the reason that care went to the hospital in the first place is because when MRIs came into being, there was these huge machines. You had to go to a brick and mortar place to get so many of these tests. Well, now you can do MRIs, you can do x-rays, you can do so many things remotely. There's somebody on my street who has a portable MRI van, which is kind of bizarre, but they do. So there's so many things you can do in the home that smartphones have enabled, that technology has enabled, that it really is kind of the frontier now.
Amazing to see how much this has taken place. What's interesting also is just the level of investment that's gone into primary care over the last several years. And curious to see if you see with your members, are they generally what I would just call mom and pop, or are they more larger outfits, private equity backed organizations that are members? What's the makeup of some of the membership of HCCI?
We work with people at all levels, and kind of are able to scale the ways that we help to what they need. Just to clarify, we are not a membership organization. There's a membership organization in the space called the American Academy of Home Care Medicine, which is the professional membership organization. And we kind of consider them kind of our sister organization in the space. They do an annual meeting and those kinds of things. Where we fit in, originally we were really focused on education and providing a lot of education for that association's membership. But now as we've continued to evolve, a few years ago, we added consulting services. We've developed an entire practice assessment, so we can go in to any size organization and look at kind of where are you today, whether you need to start from scratch or you're kind of midstream, and where are your strengths, where are your challenges, and how can we help you to get to the next phase.
And then, in our previous conversation, you mentioned around the usage of insights and data. Can you maybe share a little bit about how you're really kind of delving into that area and where that can be really impactful?
Absolutely. So what happened was a few years ago, we had an internal question of how much had things changed since we started. And it was hard to answer that question because of the lag in CMS data. It takes 3 years to get the public data. So our board decided to purchase a seat, a ResDex seat, so that we could have the most up-to-date access to that claims data. And we purchased that really with the intention of using it to gain some internal insight into how the field was changing. And what we realized pretty quickly was that data, if we added some spin to it, could be very, very valuable to the very people that we were trying to help. And so we went about creating a data analytics platform that just launched in April. And it is a SaaS, a subscription service. And people can subscribe to that. And what it allows people to do, and it's not just home-based primary care, it's home-based medical care. It covers that whole continuum that I talked about. So it includes hospital at home, hospice, home health. And people are able to look at things like, where are the most high need patients? If I'm going to expand to the next, we see a lot, you mentioned private equity. We see a lot of private equity practices that are growing kind of state by state, market by market. Yes. So where should they go next? Well, you can look at this platform and see what's the need, what's the current supply, how many people are doing this in any given area. You can look at patient demographics, everything from age to socioeconomic status. We can look at functional impairment. How many people in this zip code have 4 or more chronic conditions? How many are currently being seen by a home-based primary care physician and how many are not? So it really helps people look at what's the market opportunity. And then beyond that, we have some dashboards. We have some standard dashboards, and then we can also create custom dashboards. But some of the standard ones include things like a scorecard to look at your cost, your outcomes, so that people can benchmark against their local competitors or even a national average.
So as you were going down this journey and you started to amass this data set, do you find sometimes that you actually have more questions that populate than answers because the fact that the data set is so robust and so large? Or have you just continued to remain focused on what is that 1 or 2 questions that we need to answer, and where has that led you to?
I think right now we're still learning a lot. This just launched in April, and we're in that process. We did beta testing. We went through interviews with some of the beta testers and that kind of thing. But right now we're in that period of time where we're learning a lot from our new customers and finding out how could this platform do more for you. We've kind of started out, like I said, we've got these standard dashboards. We've got 35 standard dashboards across these 5 different areas. But but we expect that to grow as we learn more about what people need. We have kind of started out and launched with what we think are the top use cases, but are very interested, just like we talked about earlier, or a collaborative organization. So if there's an organization who comes to us and says, it would really be valuable if we could have X, we'll either do that just for them, if it's a very tailored kind of question, or maybe that becomes kind of one of the next future standard dashboards, if it would be valuable to others as well.
So who in the space right now that you've worked with is really impressing you, and why?
It's I would say on either end. So the first thing that came to mind was some of the private equity backed companies, because the fact is they just have the capital behind them to be able to innovate in a way that some of the little guys aren't, right? And so I see them making really big changes in the field as a whole, and they have an ability to scale, which is what we want to see, right? They have an ability to scale in a way that a mom and pop doesn't. But HCCI, being a nonprofit in its in its core, like you said, I'm a clinician at core. We also always want to be available and able to help those mom and pops and those smaller practices that are struggling to make ends meet and that want to be able to compete and want to be able to grow. And so I think, like the individual nurse practitioner we talked about, who just needs, who can use this data to begin to grow and begin to prove their value and maybe get their first payer contract. So I see it really, the innovation on both sides.
So that was a trick question. What I see is you guys being a player that has innovated enormously. And so you passed the test, but being a humble leader, I have to say, with flying colors, by the way, there is something to be said about being able to innovate despite constraints. And I think that when you have a limitation on resources, you find a way to innovate inside of this box. And the example that you talked about, which is, hey, let's take data that is available, with a smaller investment, and let's make something of it. And I've seen that data set prior to what you had shown me, and I can tell you that it's reams and reams and reams of rows that are just, there's a sea of data that you can't necessarily see anything. However, being able to then make it so that it's digestible, where you can take this data, turn it into insights that then leads to action, that's innovation at its core. So it's really interesting to sort of see this and to see that the fact that you have customers that are asking for this. Most often, I think sometimes you solve problems for your own sake,
Right.
and then you start to figure out that, like, hey, we're not the only ones that are with this particular problem, and how can we support this community of clients that you guys have been supporting for a number of years now. So we're coming towards the tail end, but I would just say for those that you think that you can add the most value to, what is the one ask that you would ask of them? And then on the same note, what's one thing that they could take action on that you would want them to take action on?
I think what I would encourage, well, I guess two things. So I've been thinking a lot about value lately, and I think that's what this comes down to. I think that HCCI has been focused from the beginning on helping practices establish value if they're starting a new program, increasing that value by maybe adding services, or partnering in new ways with other parts of the continuum, and then demonstrating that value and being able to show the health outcomes, that they're reducing costs, etc. And we were originally doing that through education. And I feel like what this Confer Analytics product has done is it's helped us do that in spades. It's helped us add a tool to the toolbox that can help them do that in a really much more significant way, and in a way that is data driven, which is, we know data is king, right? So it's really exciting. And I think if there's an ask, if I can be so bold as to plug it, the conferanalytics.com site, because of one of our original donors, who has a special focus on Illinois and the Illinois market, Chicagoland market, we have free dashboards on our site for the whole Illinois area. So you can go on, and I mentioned Independence at Home. There's Independence at Home demonstration information. There's Hospital at Home summary information, and there's all Illinois data that you can look at free of charge. And it just gives you a sense of what kind of information is available through this platform. So if anybody's interested, that would be my ask, is to just check out the site, check out some of the information, and see how it might be helpful.
Okay. And any other plugs that you want to make for HCCI? Anything in particular? I mean, it's your episode, so feel free.
No, I'd say HCCI, it's hccinstitute.org. And there you can find out about our education, our consulting services, and we are actually in the process of creating a brand new website, which will debut next year. So even if you go to HCC Institute now, go again next spring. It'll be very exciting.
We'll be sure to make sure that we link that in the description. And just one final ask for you. I mean, let's just say we're having a conversation a year from now and we're looking back. What would you like to see happen? What would make you feel satisfied with the growth trajectory of the company?
I think just to have this be really, I guess, like I said, we're taking that feedback from our clients, and to have this be further developed in a way that reflects what the users need. That we've obviously, gained a user base, but that it's an ever-evolving tool that becomes more and more useful to the people it's intended for because of their use and feedback.
Awesome. Well, for those that have tuned in, I just want to say thank you. If you found this content helpful for you, would you mind, sharing it on your social media channels, commenting on it? We'd love to hear just your thoughts. How do you view primary care, home-based care? What are you going to do with it? So it's always nice to be able to notate that in the comments. And I'm grateful for our community, grateful for the guests that have come on. Julie, appreciate you being able to come on and just share some of your insights, good, bad, and different. It's really helpful for the community at large. So grateful for that. So thank you. And yeah, look forward to having you come on at some point again in the future. We always leave the door open for folks to continue to share their stories. And I'm looking forward to our next conversation.
Thank you. Me too.